The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on whatever you'd like to talk about, as long as it's your health. Perhaps you've had a problem, you've tried, you've applied, you've done all kinds of things that really haven't worked very well. Well, here's an opportunity. That's why we do the program. Call me, 888-630-9625, 888-630-9625. A belated happy Thanksgiving to all of you. We're through that time and into Christmas, and oh my God, this year is going by way too fast. Yesterday I thought we were going to have to take tickets for, the Ark. It was loading. That rain was ridiculous. It came down so heavily, but the sunshine is out and it's beautiful, and you need to get outside and take a walk after you listen to the program, or make sure you take something that you can listen to, right? 888-630-9625. We've got a program for you today. And we have a class coming up at the Roselle Center for Healing this coming Wednesday evening. And what's the program about, and what's the presenter, and, all those good things? Well, it's Wednesday, this coming up the 28th at 7 p.m. And we're going to be talking about computer neck. Computer neck, actually.
Tech neck.
Tech, never mind. You're a technological crazy person. Obviously, in studio, Dr. Scott Lamp and my...
Good afternoon.
Dr. Gadget.
Yep.
Yes, particularly in this situation. Or should we call you Dr. Devices today?
I don't know. Whatever fits.
Okay, so we got computers, we have iPads, we have cell phones, we have...
All those things.
All those things.
And they're multiplying.
They are.
Yeah, it's like a cell phone business. We're $1 trillion business. We've got all kinds of new tech coming out, and it's good for our business.
It is. They just, keep coming in, keep using your stuff, everybody. Make me happy.
So that's what we're trying to look at, is what are we doing to ourselves? And, I always go back to the old one. It was a couple of years back. I think they were showing somebody being on a cell phone, and they walked right into a fountain without even looking. And so,
unfortunately, that is the truth.
And that's also, she was definitely in a tech neck problem position, but not looking ahead of stuff like that. There's those dangers, but there's a lot of dangers that are insidious that happen with this kind of thing that you don't realize that builds up over a period of time, and we're going to see more of it.
There's a real condition actually that's recognized now by the medical community. It's called computer neck.
Yeah, well, the slang term is tech neck, and it's the same thing. We have all this head that sits on a part of our shoulders, and it's all these pulleys and levers, and they're good when they're all balanced, but when they're not balanced, you put a lot of stress on things, and what happens is we start building up these symptoms and problems that. It doesn't happen necessarily for the first week where you're working at your job. It could start building up on you maybe in about 3 or 4 years, and all of a sudden you understand where this neck problem came from, and you don't seem to have any cause and effect that it started in the first place, but it's really your posture.
Dr. Scott, I know you come into my office all the time, and you're always on me because of my position.
And our positions right now are actually...
Yes, we're looking at each other, and the computer's to the left, and the microphone's over here, and we're strained like crazy, right?
Right.
But the truth of it is that there's so many times I'm sitting there, I'm trying to get work done, and my papers are all over the place, but we won't go into that.
Right.
And, that I keep turning and pivoting and so forth. But this, for me, I get up and I'm seeing patients and I go back. But there are people that are sitting there all day long.
4, 8 hours, 10 hours, 12 hours.
I'll add a real quick story. I'm going to ask you a couple questions. Everybody knows, so I can, talk about it freely, that, for the 6 years that he was here, Kirk Cousins was a patient of mine. I saw him every week, sometimes twice a week. And he kept coming in with this skull that was jammed and locked back. In our business, that also weakened some lower extremity muscles.
Right.
And I couldn't figure out what in good God's name was this, why was it coming back? So I caught one of the games, and generally I don't pay too much attention to the sidelines. But here he is. He's just like a typical young guy, right? He's stretched out on the bench. He's got, today all the game plans are on pads, right?
Right, the iPads,
so
right.
So he's got it in front of him on his lap. His head is bent way forward.
Right.
And I said, that's where he's doing it. That's why I keep getting this weakness that keeps coming around, and that I have to fix week after week after week after week. That's common.
Right, and it's very, very common. And I think if we can get into the specifics a little bit of it, when they talk about when your head's, it's 12 to 14 pounds. Mine's 14 pounds. Maybe yours is 13 pounds.
Be careful. Be real careful, Scott.
But when you have the head on top of the shoulders the way it's supposed to be, you're over the shoulder, and you're in the proper position, that's how much it's supposed to weigh for the body. But when you start bringing the chin forward by 2 to 3 centimeters, you're doubling the load. So they say, well, if you're looking at, like, for example, a cell phone, where most kids do, and most are doing it more than 20 minutes, you drop your head down to your chest, that's 60 pounds on your head. That's on 60 pounds on your shoulder. That's what it converts to. And you do that for a prolonged period of time. It's like really having a gorilla on your back.
So you have a pendulum effect that's causing a gravitational pull on the head.
And on top of that, think about what happens with the position. Like, Tom, if you hold a nail and I hit the nail with a hammer and the nail's straight, where's the pressure go to?
I'm not holding the nail for you.
Well, just play along.
Okay.
Right. Sometimes I have to give them a look. But anyway, so when you hit that, the pressure goes right to the tip of the nail, right?
Sure.
Well, what happens if you hit the nail and the nail's bent?
It bends it more.
It bends it more, or distributes that energy somewhere else, right?
Right.
Well, what happens? We have curves in our neck are designed to work like springs. You drop your head forward, the neck becomes straight. Now you're putting pressures directly through things you're not supposed to and not distributing the pressure off. Now, if the bend in the nail is too much, you can snap the nail. So sometimes you can go in the other direction. But one of the problems is when you drop your head down, everything lines up straight. You're putting pressures on things that are not supposed to have pressure on them.
True, and the neck, as many people do, most people don't, has a natural curvature.
Right.
That is actually a triangle and balances any kind of the stress load from the head. But when you bend that head forward, you're straightening it out. You're losing that curvature.
And not only that, you got a curvature in your thoracic spine, or the rib area, where your ribs are at. That gets even increased, and then the lumbar spine, which has a curve similar to the neck, that loses too. So you're actually, when you drop your head, you take a lot of those curves out of the whole body, not just the neck area.
My guest in studio, Dr. Scott Lamp. He'll be your host this Wednesday evening, November 28th at 7 p.m. at the Roselle Center for Healing in Fairfax. Love to have you as our guest. Tis the season, and you really need to know how to fix some of these things. And before you go out and buy another pad, another computer, another cell phone, and so forth, we're going to give you some information today. But more importantly, this Wednesday, he's going to teach you how to save your neck and shoulders so you don't have that pain, that soreness, that constant irritation. And we'd love to have you as our guest. We'd love to show you the office. All you need to do is go online, go to rosellcare.com, and register right there. It says register now. Hit the button, or simply call 703-698-7117. Dr. Scott.
Yeah,
it's going to be, as a matter of fact, I got to pay attention this Wednesday when you do that, because I noticed, yesterday I was on the computer all day long. I'm doing a new program that I'm teaching in January. And by the time, and I get up and down, but I realized that I had information stacked all around me. Right. And I kept looking down at the chair and, copying things and then throwing stuff and then going on different screens. And I had by the time I was done, and I spent about 3 hours, 3.5 hours doing it, but I hurt. I was sore.
Right. It's interesting. A lot of this stuff when we talk about ergonomics, is really kind of study of the man in his workplace. A lot of the information comes from the University of Michigan. They do a lot of the studies out from there. And they said you should actually move every 20 minutes, even in a good position. And then moving might be only for a couple of seconds, just to move to reset the body so it doesn't continue taking that strain. And I think I've talked to you before a little bit. They say that a ligament will change its position after about 20 minutes of sustained pressure on it, and not necessarily in a good position. It overstretches, making something unstable.
Well, it's called Wolff's Law.
Yeah. And then if you if you don't do anything to reset it, which means stretching it or getting some therapy on it or doing something to kind of reset it, and within a week and a half to 2 weeks, that can become permanent scar tissue. And that's how it catches up on you.
Well, any kind of injury, within 72 hours, of and we're talking about, this is an injury.
Right.
This is not just, you're sore because you've overworked your muscles. This is injurious to the ligament and tendons. Within 72 hours, you've injured the ligaments, but you also injured the nerves as well.
Right. And
with scar tissue that forms around it. And now you have permanency.
Right. And so that's the thing. It's just and it's very insidious. I remember there was a company that used to make brake pads. They used to do work in an ergonomics center out in St. Louis when it was during grad school. And there's a person who was working at this job for about 15 years. She had, or you could look at her chair and she molded into her chair her buttocks. You could see her her pattern was molded into that chair. Her screen was way far down. And she was literally walking over. She looked like she was halfway bent over. And she was so bad that when you try to raise the screen, the arthritis wouldn't let her get her head up. I mean, sometimes even when you're doing treatment on some of these people, you got to do things back slowly because now you got to stretch in the other direction.
Correct.
If you put it up directly where it's supposed to be, they're not going to like it. They have to bring it up progressively slowly to kind of make them work a little bit better.
You know, there's the old the current statement that talks about an old situation that sitting is the new smoking, and
Right.
the problem is that it has a profound effect on the heart and the lungs. Because if even only neurologically, you're irritating the nerves that go to these organs, and they're
Right.
not firing properly, and you're compromising the cavity, if you will, the chest cavity that houses the lungs and the heart, and now you're putting pressure on them that doesn't need to be there.
Well, if you take a look at the segments of the spine anyway, C1, C2, and if you got to look at things in regards to the vagus nerve, you speak a lot about the vagus nerves and those kind of things. The majority of the nerves of the heart are on C1, C2, T1, T2. These are vertebrae that we're talking about. Those are the ones in the rib cage in the very top part in the lung area. And when you put your head forward, you're irritating the nerves directly, let alone if I'm rolling my shoulders, I'm pushing pressure on my front cavity. I'm putting pressure directly on the organs themselves.
By the way, so those of you seasoned listeners, you know what C1 is and you know what T1 is. But for those of you who are not, the neck is cervical spine, that's C,
Yeah.
and the upper back where your rib cage is, that's thoracic spine.
You can talk, Doctor. What was that? What was that? A couple comments you said? I was Doctor. What?
Never mind. 888-630-9625. That's 888-630-9625. Love to talk to you. My guest in studio, Dr. Scott Lamp. He's giving you a little bit of what you're going to get a whole lot of this Wednesday evening, the 28th at 7 p.m. We're going to be talking about surviving the computer age. Yeah, really, figuring out how to make it better for yourself, because we are in that electronic computer time of our existence, and it's not going away. It's just going to get more overbearing. And think about the amount of time that you spend, and this not even with the computers, but people who are sitting watching television.
Right.
And it's the same type of thing. They have their screens. We're sitting here. We have computers all around us in studio. We have big screens around us. And as we're turning, we're looking at each other and so forth. We're definitely not in a normal postural pattern,
Right.
And that can take its toll. So even when you're just hanging out watching stuff, you're putting stress on your body.
Are you watching between your feet to your television and your bed?
Oh, I don't make it that far.
I mean, I'm
usually
looking at
asleep
it.
by then.
I just pulled something up here from the Kaiser Foundation. It said 75% of the children have televisions in their bedrooms.
You're kidding me.
It says, and then
75%.
75%. 68% of 2-year-olds regularly use tablets, and 59% have smartphones, and 44% have game consoles.
Parents, grandparents, listen up. When your child goes to the bedroom to go to sleep, frisk them and take away their pads, their phones, and don't let them have a television in that room.
And we'll probably talk a little bit on the talk on Wednesday, too, about EMF fields, or electromagnetic fields, that let alone the physical element, you've got some of those things happening with this stuff, too.
They're burning the brains out. Absolutely burning the brains out. Kids do not have the blood-brain barrier protection that they need to have, and all these low-volt electromagnetic fields are constantly irritating their body. We're going to talk a lot about this today, but specifically this Wednesday evening, Dr. Scott's going to get into it. But learn how to protect yourself. And if those of you who have heard Dr. Scott, he's going to get into positioning, what you can do, how you can help yourself. You're going to go home with a ton of information. I mean, that's why we call him Dr. Gadget, because he really gets it. He understands it completely. We're coming up to that point where we have to say we've got to take a break, and this is an interesting program. I'm learning a lot just by discussing it with you. Don't go away. You're listening to Dr. Tom Roselle Live. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. See, it's Sunday. It's just after 12 o'clock, so that means the Redskins are not playing close to this time frame, because otherwise we would be on Saturdays. But we're here on Sundays. This is like Groundhog Day. It's just like, I can't get it right yet. It just keeps flipping and rotating, and it's madness. So hopefully we'll get this straightened out for next year.
I hope so.
I hope so, too.
Anyway.
In studio, Dr. Scott Lamp, your host this Wednesday evening at the Roselle Center for Healing. We're talking about computer neck and actually all kinds of things that relate to your devices. And the problem is that you have a postural compromise. You're putting yourself in positions, working on your devices, listening and checking your mail. that is abnormal, and subsequently neurologically and mechanically you're suffering, and then soon viscerally internal organ systems are going to suffer as well. So this Wednesday night he's going to be talking about not just this thing called computer neck, but all the ramifications thereof. He's going to be talking about the head and neck pain, the eye problems, the visual disturbances, the hand and wrist problems, the numbness, the tingling, and then ultimately the problems that you're going to have with heart palpitation and shortness of breath and digestive function problems. Yeah, all of these things can come about just because you're on your devices on a day-to-day basis and without break and without postural adaptation. Having said that.
Yeah, and when you just listen, I think we should talk about some of the signs and symptoms that you don't think about. Do I have numbness in my hands? Okay, that would be a tingling sensations, a nerve entrapment possibility, a lot of different possibilities coming from the neck to the hands, the elbow, so on and so forth. Are you having headaches? All right, having headaches, and especially headaches that go around your ear, or you got a headache behind your eyes, or you got pain in the neck, in an isolated area or a diffuse area of your neck. You got pain in your shoulders. You've got jaw pain. Jaw problems. I have a hard time raising my shoulders up past 90 degrees or maybe even 120 degrees in front of me, because now my shoulders are rolled so far forward, I'm starting to develop that hump in the back, and all of a sudden, next thing I know, I can't raise my head or can turn my head.
It's postural.
Those are all postural-based things from repetitive, slow, insidious changes. Now, on top of that, you can accelerate that by an injury, whiplashes in cars and so on and so forth, sports injuries, falls, nicks, and whatever they might be. But all those play a part with that also. But digestive problems, about acid reflux, they could actually be related to your posture. People don't realize heavy breathing or breathing problems, and as Tom, you were mentioning before, I can't get my ribs to move well. And then sometimes after a period of time when my arms are moving forward and I start walking, and you watch the person walking like, he has no arm swing. He has no arm swing. That actually helps liberate your ribs to open up so you can breathe better. So how much pressure does that put pressure on your organ system, so your lungs have to work harder, your heart has to work harder? How much farther does that take you towards putting your foot in the grave?
Here's the interesting thing. The patient came in the other day, and the reason that she came in is that she was suddenly losing her eyesight and her hearing.
Mm-hmm.
And her doctor couldn't give her any reason why. They just say, well, you have this high-frequency loss, and you have this, and
old
you have
age.
the other thing. It's old age, yeah.
Yeah.
So the problem was she was only 50-some years old.
Yeah.
But her job is one that she has straddled the computers all day long. And she's in one of those job situations where, she's got incoming on a constant, moment's basis. So she came in to see if there was anything that can be done, because another patient had told her that she started getting treated. And so I went through the process, and I started asking her, I said, do you ever get any relief, from this? She said, well, it gets better, when I've had a chance just to get away from work and relax a little bit. And so I took her through the process, and here's this woman who is being compromised. Why is it affecting the eyes and the ears? Well, all those nuclei come from the lower portion of the brainstem,
mm-hmm.
and so she's straightening her neck and irritating and tugging on those cranial nerves, and now she's got disturbances in her eyes and her ears.
Yeah, and it's an interesting thing. It's like I tell people, let's do this like CSI. You can do an investigation. I heard at the end of the day, but at the weekend I'm okay. I'm sleeping and I have a problem sleeping, but I wake up for the rest of the day, I'm fine. What's the problem? So it's really kind of go back to those things. You just said it there. She seems to, when she gets away, she can seem to calm and things seem to get better. And then when she goes back to work, like I always like to ask, what happens on Friday? Can't wait to get out of the office.
And some people end up on Fridays, they end up with massive migraines for 24 hours simply because in their posture position over these years, they have compromised the blood flow during the week because of the muscle tension, the straightening of the spine, and so forth.
Right,
and now
exactly.
they normalize, and suddenly, boom, they've got this because now the blood flow, everything relaxes, and the brain can't handle it as quickly, and they've got these migrainous type of patterns. So anytime they relax, it's like not a good thing for them until you normalize it.
Yeah. And, we're talking about signs and symptoms. Another thing is we talked about, we're focusing on neck and shoulders, but low back could be bothered by this. You're not supporting your base. A lot of times when we're doing things we'll talk about on Wednesday about how you do support your base, but to get the base set up, that kind of sets up a lot of the other things. It's kind of like working on the Leaning Tower of Pisa. Do you want to work on the attic?
888-630-9625. Coming up to the midway portion of the program. Love to talk to you. If you have any problems with your head, neck, shoulders, body, whatever, we're talking about something that can cause a very common problem. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. We're in studio. It's gorgeous outside. I am going to go play today. It is really lovely, particularly after the monsoon season that we had for the last 24 hours or so. It was crazy out there. 888-630-9625. That's 888-630-9625. That's how you find us here. And when we're not here, it's simple. Go to rosellecare.com, ROSELLECARE.com, rosellecare.com. And that's how you register for Dr. Scott's program this Wednesday evening at the Roselle Center in Fairfax. We're going to be talking about a computer problem that affects your body. I mean, the position that you get into on your devices and your phones, on your computer screens, and your television screens, how you sit, how you rotate your body, the things that the injuries that are coming about, the eye strain, but more importantly, the overall health depletion because of this. And I think we're going to see over time, Dr. Scott, is that people's health, their health index, their health quality, their longevity is going to take it in the neck, so to speak.
Yeah. It's interesting. It seems like every time I go on this show, I talk about blue zones. And the elements of, what's that?
The blue screen.
Yeah. And the people that actually live longer have the highest ratio of 100-year-olds than anywhere else in the world. And one of the things that you look at the overlaps of all the different places, Costa Rica and Italy and Greece and Loma Linda, California, Okinawa, Japan, and those kind of things, that they do a lot of flexibility. And I think one of these things, the technology, I mean, we hate to have flexibility for a lot of different reasons. It pushes fluids, it feeds our organs, it feeds different things, keeps us taking pressure off our bodies so we don't get the aches and pains. And this is a device that sucks a lot of that flexibility away. And we got to be cautious with this. We're raising our kids off, like I just gave the statistics before. We're raising our kids off so this is supposed to be the norm. And a lot of these other countries really don't have that tech savvy. I mean, you've got, I guess, when you're going out to some of those things, like Okinawa, Japan, but they're doing a lot of things. They're doing a lot of walking. They're doing a lot of gardening. They're doing a lot of farming and stuff like that to keep themselves flexible. People at 90 years of age they're doing work. They can do some work in the kitchen. They can do some things. And they don't have all the medications and the steroids and the painkillers and anti-inflammatories that are out there that we have. And they're actually showing us, like, wait a minute, this is the better way to live.
Well, we have this thing called neuroplasticity of the brain and of the spinal cord and the peripheral system. Mm-hmm. Years ago we thought, well, the brain wasn't adaptable. Now we know it is. But then we said, well, it's the brain. Well, no, it's not. It's the peripheral system as well. So your brain and your peripheral nervous system can be modified by its environment, and we're talking an abnormal modification right now. We're talking about things that shouldn't be and can cause all kinds of downstream problems because of the posture patterns we're talking about, let alone, you talked briefly about electromagnetic frequencies, the low-volt electromagnetic fields that are there doing tremendous amount of damage, particularly to kids. But all of us, in the pixels that come off the screens and the blue light that comes, they're damaging to the nervous system.
Yeah, and so, I mean, there's so many different factors that play a part with what we do with the digital element. I mean, I will even touch a little bit on the subject of digital dementia, where some of the cognitive behaviors that we're doing and what we're learning on children is going to be altered to some extent too. I mean, there's a whole element of how life is supposed to be. You don't work around. You don't play with toys physically as much as you do anywhere and try to learn what gravity does. Oh, I dropped this. I'm going to hit my toe with this. It's going to hurt. Versus I'm doing something on a screen and I'm not physically getting involved with the environment. So the cognitive ability and how you're understanding the world is altered.
Well, here's an interesting thing. I posted this morning on my Facebook page a problem that has to do with ADD, ADHD, attention deficit syndromes and hyperactivity and those things. And a commentary was, this is a fake diagnosis. It's a big pharma puts out there, put people on drugs. Well, there's yes and no to that. It's not a fake diagnosis. There are people who have very significant ADHD problems and ADD problems. And by the way, I was one of them for years. I had really learn how to fix me because my brain's all over the place. But at the bottom line is that what we're talking about today makes these things exponentially worse when it comes to learning patterns as well, both in adults and children.
Right.
And so because the screens are moving so fast, the information is so quick, and then when somebody settles down to do something that is not engaging, right? But as I said in response to several of the comments, drugs are not the are not the fix. You got to find out what's causing the issue, and we're talking about a very specific situation that can cause and trigger the problem. And this Wednesday night, I know you're going to get into mechanics, but people suffer in today's world with so many bizarre syndromes that are really, if you stop back and you think about it and you start taking it apart, you do the investigation, as you were talking about earlier, you become, you become knowledgeable in. We have this environmental impact called the computer age that is destroying people, and that's what you're going to cover this Wednesday evening. Let's go to the phones. Diane, how can I help you? Thank you for calling.
Well, thank you, Dr. Roselle. I spoke to you several months ago, and I told you that I had a very serious fall, and I had a C2 fracture. They weren't giving me much hope for it to be resolved, but it has been, except that I have problems with numbness in my left arm, even just driving the car and bending it that way. At night, it wakes me up. Is there any hope that this will ever change?
Sure, absolutely. Now, it's been how long since you've had the fracture?
I had it at the end of, let's say April 1st.
Well, the first thing we have to do is thank God that you're still with us, because
I know.
C2 fractures, when that happens, it's called a hangman's fracture. That's how they used to kill people.
Yep.
And so the fact that it's there and if it's stable, and once something heals, if it heals in place, it's probably stronger than it was before. But
because I was seeing a neurologist at UVA, and at first he said it was never going to heal, but then I saw another one, and he was much more optimistic, and I took the darn collar off when it was 80% healed, but as I said, I am having this problem of numbness, and it wakes me up at night.
So the problem, Diana, is not the fracture. The problem is the misalignment and pressure on one of many of the areas of either the spinal cord or the nerves that come off of it. The nerves that go into your arms and your shoulders come from the lower part of your neck. So when you have that injury, you're going to have injury to the entire neck or the cervical spine. It's going to irritate those nerves. It's called the brachial plexus. That's what's going into your arms. The vagus nerve, the one that I talk about a lot, comes down from the brain, and it's very, very close to that first cervical, that upper portion. That first cervical is called atlas, and the second one is called axis, by the way, as well. And any rotation can pull on the covering of the cord. That covering is called the dura, hard matter. And if it causes that to tent or to pull too hard and put pressure on the nervous system, you can have a plethora of different types of symptoms. Numbness and pain can be one of them. So the short answer to answer your question, yes, there's a lot that can be done to make a difference. Fortunately or unfortunately, we've treated many of those conditions over a period of decades that we've been in the business. And we see a lot of them in traumatic injuries where people have had car accidents and they've been thrown into the windshield, or, particularly with athletes, football players particularly, where, years ago they used to use their heads to spear with.
Right, yes.
And we see those, and we've had a lot of experience treating those. So as long as there's no displacement, meaning there's no deviation of one of the bones over the other, and it's healed.
How would I find that out?
That's just a matter of looking at your X-rays. I can call the lab and find out, with a very brief conversation. What I would suggest that you do is this. Here's an opportunity. If you have the opportunity, join us Wednesday evening. If you have any old X-rays, of that, not old ones, but recent ones, something that's been taken within the last few months, bring them with you, and either I or Dr. Scott will take a quick look, and we'll see what they if we can pretty much tell whether it's stable or displaced. The displacement is the issue.
Well, I greatly appreciate your advice here. Unfortunately, I live in Culpeper, and I have a situation, would you believe, after I got rid of the collar, I fell, and I'm now recovering from a hip fracture.
Diane.
I know. Well,
this is not okay. So listen, what you're going to do is you're going to get this squared away, And once you're ready, once you can move, bring your films and let's take a look at it, and we'll do a consultation, and we'll see if there's something that can be done, and we can tell you very straight up by looking at them, okay?
Thank you, and I'm just glad to know that there is some hope.
There is, absolutely. You just have to do it the right way, Diane. Don't let anybody drug you, and don't let anybody cut you. There can be a very easy conservative fix on this. We've seen it thousands of times, and I say that literally over 42 years of practice, and all the guys that have worked with us. 888-630-9625. That's 888-630-9625. My guest in studio, Dr. Scott Lamp, your host this Wednesday evening at the Roselle Center for Healing. We're talking about computer problems, and not the ones that you called the tech guy to fix, but the ones that cause you pain and discomfort and headache and numbness and tingling and visual disturbance, and ultimately affecting your nervous system, and that affects your heart and your lungs and digestive function, and but the bottom line is you got to do something about it. You got to fix it, and you don't let your kids stay on these devices continually, because you're causing them a tremendous amount of potential disability as time goes on, not only physically but as their brain works as well.
And also when they advance in ages, is what are they used to? I think it's just built on patterns that we start to develop early, and that's what they get comfortable with, and that's the age of that. So there's an interesting thing, and it was kind of funny if you ever saw the movie WALL-E from Disney.
Yes.
And did you remember the message on that? Remember all the people who were overweight at the end when they finally had to wake up the ship and get everybody moving? It's kind of funny because is that where we're going? It's like everything's being done for us, automated, and we've got to get us. And the thing is, we still, as human beings, need to move. We need to be able to get proper posture. We need to eat right. We need to don't expose ourselves overly well to certain things. I mean, we're going to have to work with these machines. But there's ways that we'll go over on Wednesday how to handle that. What should you do? What is a good course of action? What's a good course of stretching? What are those type of things? What's the right type of equipment? I mean, that's another thing. So it's really equipment. How do you apply yourself to the equipment, and what can I do for myself physically to make things work better?
Yesterday I was sitting in my office. I was working, as I said earlier, and I got hooked on this YouTube video, and it was a guy that supposedly had time traveled into the future. He works for the government. He was exposing the government that time travel is real, and he was working on the Philadelphia project. And said no. And he went on to talk about this civilization 600 years from now.
Yeah.
And obviously it was a mock-up, and they added computerized technology to it, and he basically was saying that in this future society 600 years from now, computers ran society and people just existed. They really didn't work. If they wanted something, they could do it. If they could go, but the physiology of these people were, as you might expect, where people don't do anything anymore. Their brains didn't have capacity and so forth. And he said that people could live in, the outlands. They called the outlands, but they couldn't live in the cities. And the cities were anti-gravity. They could float all over the place, and so they had multiple stack. They were vertical cities. Yeah. I know people are saying out there, Doc, you've been drinking way too much. It's the holiday season. I know you've been hitting that bottle again, and it's not Christmas Eve. I am not yet.
Sometimes he's jolly. That's all I can say.
Absolutely. 888-630-9625. But the point is that we're seeing technology destroy the human body.
Right.
And the body is rapidly breaking down. But the point of it is you don't have to deal with all the pain and discomfort. You can be preventative. You can be proactive. And that's what this program's all about. And that's why we do these classes, by the way. That's why we do in-house programs, is to give you the data, the information that you can use to make a difference. So when you're going out and buying your Christmas gifts, and you're buying somebody a new this and new that, wouldn't it be great if you were armed with the information that you needed to be able to set it up properly, to be able to salvage some problems? This is an opportunity this Wednesday evening. Join Dr. Scott. Scott, I know that you're going to be, you always do, you're going to be talking about postural positions in addition to that, how to set things up. I know you're going to get into all that in detail. Right.
Yeah, we're going to talk about the positions, I think, not only from, we got the sit-stand tables now, too, that are coming up that they think that, I get a sit-stand, I can just raise it up and my back's okay and everything's fine. But sometimes you're in the same position that you're bad in when you're sitting than you are standing up. You're just taking some of the back out of the equation. So we're going to take some time kind of looking at those and doing a couple examples. I'll take a couple of people out of the audience and kind of go over and kind of show them how to do things and what kind of devices are out there that can make things work a little bit better and understand those kind of things. And then, what kind of pains? We go over a little bit of pain syndromes too. We'll just talk about what's a nerve pain, what's a ligament pain, what kind of muscular pains you have, what type of things they have. But generally, again, I call it when my patients come in and they say, we got 20 minutes to work on you, 10 minutes to work on you, whatever. But then you have to go out and play out in the highway of life. And depending on how bad the traffic in the highway of life that you're playing in, you've got to look. It's a do-it-yourself, like your book is, and we talk about the do-it-yourself process. You got to really look at yourself, what you're doing in that type thing. A lot of times you can get caught up in the highway hypnosis of being on a computer, and 4 hours later you're like, oh my God, the time went flying by, and you've got pain, and you have pain. You might not have pain. And one of the things too that was interesting that we talk about also is, like, when you have pain, don't wait for pain. That's a threat. You want to be doing things before you get pain.
Yeah, once you have the pain, it's telling you that you got a problem. There's something there. Pain is a signal. It said, listen up, people. You've gone way too far. And here's the other thing. How many people, and we're going to save this to Wednesday evening, how many people end up, because of the devices, because of they're in front of them all day, with cancer? And They end up with cancer of the gonads because they have their laptops on their lap. They have cancer of breast tissue. They have problems with their heart because they keep their phones in their shirt pockets. I go crazy when I walk down the hallway and I see a patient with their phone in their shirt pocket. I say, do me a favor, get rid of this thing. We'll talk about that as well just a second when we come back. We're coming up to the final portion of the program. Give us a call, 888-630-9625. You're listening to Dr. Tom Roselle Live. My guest in studio, Dr. Scott Lamp.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You've been listening to Dr. Tom Roselle Live. I'm in studio, 888-630-9625. That's how you find us when we are here. And it's Sunday. We are here, and we're here every Sunday, generally at 12 noon, because we want to bring you the most important information to make sure that you are able to participate in your own health and not just become the recipient of advertising and marketing by those who have an agenda. It's important that you understand that you are subject to the environment of your world, that the things that you surround yourself with, the things that you do, have a tremendous impact on your physiology and your health generally. So if we fail to provide that information to you, then somebody else is going to take advantage of you. And as long as I have this microphone, we get to tell you the truth about things. This Wednesday evening, Dr. Scott Lamp, my guest in studio, will be your host, your presenter at the Roselle Center for Healing. And he's going to be talking about computer problems, but not computer problems that you got to fix when you call the tech guy, but the computer problems that you can fix yourself, on your body. The neck and shoulder pain, the headaches, the irregular heartbeats, the numbness, the tingling, the facial tingling and numbness and so forth. Those are all part of the modern age of computers. Wouldn't you like to know how to make sure that you can alter that and fix them? Wouldn't it be important to you to realize that if you don't fix them, you have a problem? All you need to do is get online, go to rosellecare.com, that's ROSELLECARE.com, and register for the class. And I promise you, you're going to go away with enough information to fix things, and he'll show you the things that you can do in your environment. Dr. Scott, let's get back into this just a little bit. I touched upon the physiology that can be disrupted to the point of causing cancer.
Right.
True or false?
True.
Any codicils?
Well, I think
it's a big net, and it's one that we can talk about. But the electromagnetic fluxes that come off the computers they're basically xenoestrogenic in their effect on the body, and they can cause the body to break down.
Yeah. I think one of the things too is I talk to people. What's the lowest common denominator in the body? It's you go down the vibration of the molecules, and that vibration is electrical and bass, and directly get affected by these fields. We're still looking at the details of these things, and I think you got $1 trillion industry in cell phones. Everybody's going to need them, and a lot of times some of the information that's good about or bad about is suppressed a little bit in the news. You really have to look for it. And so it's something to consider. We do some demonstrations with it. They'd be interested to see those type of things. I suggest for people actually bring some of their devices in. If you got a device that's supposed to be healthy for you, bring it in regards to like things that you do for computer use, and I'll show you if it's working or not working.
There's a very quick way of determining whether or not any of your devices are harmful or they're neutral or they're supportive to you. And wouldn't you like to know that? I mean, your Bluetooth this and your Bluetooth that. How many people, and here's the other piece that a lot of people don't know when it comes to technology.
Right.
How many people are wearing the new hearing aids that are Bluetooth?
Right.
And they're hooked up to their devices.
You have a battery, you got a problem. So that's kind of like the way to look at it. You get electrical flow going through that, you've got a problem. So anything's going to be like that. So if I get, like you said, the ear aids, hearing aids, those kind of things, the Bluetooth, battery's a little smaller, but still creates a problem.
Sure. So you add that to your cell phone, you add that to your iPad, you add that to the other devices that you're surrounded with, and so people are saying, okay, so how am I going to live? I got to have my, we are so technologically hooked anymore,
right,
that people without, you take away their cell phone, they lose their minds. You take away their iPad where they can't sit and doodle, and they don't know what to do themselves.
And
it's a scary society.
That's the dimension part of it too.
And that's the dimension part as well. So if you have losing your brain, developing cancer, heart disease, numbness, tingling in your face, headaches that you can't get rid of,
digestive problems, jaw problems,
this is Wednesday night. Is the night for you. Show up. Well, you know that Dr. Scott delivers a tremendous amount of information to the point where sometimes we have Scott. Enough. But, I mean, he just keeps going because, why? Because he loves you. We're coming up to the end of the program. Unfortunately, we have a whole lot more to...
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.